Okay, so I'm going to talk about testosterone. Yeah, so just a bit about me. So I am from ATA Medical. So I'm a family physician, and my training is in family medicine. But I also do a hormone replacement therapy for some of my patients where indicated. And one of my interests is actually in lifestyle medicine as well, which is a prescription of lifestyle change for my patients. So I don't just believe in prescription, but I always encourage them to exercise, to watch their diet, to sleep well and sleep better in order to reverse some of their conditions. So what I'm going to talk about today, what testosterone is about, what is low testosterone, some testosterone boosters, and also, of course, some myths and facts about testosterone. Yeah. So what is testosterone? This is a pretty complicated diagram, but I'm just trying to show that actually testosterone production is not so straightforward all the time, right? It actually starts off with a part of our brain called the hypothalamus, and then it goes down to a pituitary gland, which is another part of the brain, and the signals and the hormones then communicate with the testes to produce testosterone. So I'm just showing you this because later on I'll be talking about the different ways of how testosterone production can be affected. Yeah, and any part of this pathway that goes wrong, right, can affect the testosterone production. Okay, so a fun fact is that actually females do actually have some testosterone as well. All right, just that of course the level is much lower than a male's level of testosterone. So very busy slide, so I'm not trying to go through every single thing, but I'm just trying to illustrate that testosterone does have a very wide-ranging effect on our body. So testosterone actually works on any cell that has what we call androgen receptor, and that ranges from like obviously our muscles, to the genitalia, to blood production, to our mood. All of these parts of our body can be affected by the testosterone hormone. So there is quite a wide-ranging impact if we have low testosterone. So why it matters, right? I think most of us would have been familiar with such things, right? It starts off with our brain, our cognition, our feeling of well-being, right? It's affected by our testosterone level, right? There are also some studies that are being done that has also showed some benefit in terms of the muscle mass and the body fat level. And low testosterone also has a wide variety of symptoms, which we'll go through in a bit of detail later on. And just bring home the point again that it affects many different systems in our body, from our muscles to our brain to our heart health. And that's why it's pretty important to be aware of what our testosterone level is and to really optimize it throughout our lifetime. Why bother? I mean, this is actually a slide talking about mortality, which means the risk of death. Okay, so on this side of the curve, all right, it's talking about the risk of dying or surviving, right? And over here is the number of years that you remain alive. So in the green chart, right, it shows that the males with the lowest testosterone level tend to have a shorter survival period compared to the blue line, which shows men with a higher or normal testosterone level. So it doesn't necessarily mean that, of course, having low testosterone causes death, all right? But it usually means that low testosterone is usually a marker of poor health. So men who are obese, who have type 2 diabetes, for example, have insulin resistance, they are people who tend to also have low testosterone, and therefore they are at higher chance of dying early. So what is low testosterone? I think many people have varying perceptions on what low testosterone is. And this is very important to know that we don't just diagnose low testosterone based on symptoms alone. Okay, we actually have to confirm it with a blood test, right? Because, I mean, if you look at all the symptoms here, right, there are 100 different reasons for every single cause of low testosterone. Okay, so we can't just diagnose it just based on someone's feelings. Okay, we actually have to confirm it with a blood test. Yeah, so I'm going to talk a little bit about the total testosterone and free testosterone as well, in case anybody wants to do the test on your own. Yeah.
If you have low testosterone but no symptoms,
yeah,
do you still potentially need intervention?
So theoretically, no. Yeah, because everybody has a different kind of feeling and response actually to the testosterone level in our body. So we are actually only supposed to be treating those with actual symptoms and not just having low testosterone levels. Yeah, having said that, if the testosterone levels are really low, then we may need to discuss about treatment, because some of these symptoms, like I said, are just so vague that the person may not even realize that he has those symptoms. Right? For example, things like fatigue or reduced energy. I mean, this is something that is pretty common that people are experiencing all the time, right? So he may not actually perceive that he's been having low energy, but I mean, if the testosterone level is really super low, maybe we might give him a trial of treatment to see whether the level goes up. Yeah. So I was just trying to illustrate this point about the reference range. So some people do blood tests for testosterone levels, and you will see a reference range usually at the side. And this is a very wide range, all right? And it doesn't mean that as long as you are within this range that your testosterone level is normal. Okay, so there are various guidelines that people use, and most of them use the guideline of 300 nanograms per deciliter. So if you can see here, 300 nanograms per deciliter is actually above the lower limit of the reference range. So we can't just interpret the level of testosterone based on the blood test alone. Just by looking at the reference range, we actually have to take it into context. This side here is a very small, I know, but I just bring across the point that actually across our lifetime, right, as we grow older, the reference range actually kind of shifts downwards because our testosterone level does decline with age. So someone who is younger, in their 30s and 40s, even if it's not 300, I mean, we'll definitely be looking into the causes for low testosterone already, and we might not start treatment, but we want to look at the reversible causes for the patient. So just a quick explanation of what total versus bioavailable versus free testosterone is. So testosterone is a hormone that is floating around in the bloodstream, right? And actually, most of it is actually attached to proteins in the blood. Yeah, so part of it is attached to albumin, and another part is attached to what we call SHBG, or sex hormone binding globulin. Yeah, and the significance of knowing this is that the testosterone that is bound to the proteins, they are actually not exactly something that exerts a very strong effect on our body, right? What exerts the greatest effect is the free testosterone, and that is only a very small fraction of the total testosterone level, okay? Nonetheless, I mean, most of the international guidelines still use the total testosterone level for diagnosis of total testosterone, or rather testosterone deficiency, because it is commonly done, right? It is more easily available, right? The cost of doing a free testosterone level is like 3 to 4 times the price of just the regular total testosterone level, right? So this is just something to note, that sometimes even having a normal total testosterone level does not mean you actually have a normal free testosterone level, and that can sometimes account for the difference in symptoms, where a man feels that, you know, his symptoms are very prominent, but when he does a total testosterone test, right, it seems to be normal. Okay, so in my practice, I tend to encourage patients to also check out their free testosterone level as a one-time off, right, just to see if it is truly proportionate and what we expect to see compared to the total testosterone levels. Yep, so it's quite a busy slide as well, but this just brings home the point that there are various kind of conditions ranging from aging to obesity that affects the SHBG level. So if you can recall with me, the SHBG is the one that binds most of the testosterone levels. So if you have any conditions that kind of affects the SHBG levels, then the total testosterone, or rather the free testosterone level, would be significantly lower or higher, and therefore there will be some confusion with regards to the symptoms and the level that we are measuring. So there are various ways to check the free testosterone level, all right? The most accurate way is actually a direct measurement, is what we call the equilibrium dialysis kind of measurement. So in this situation, we actually, in my clinic, we actually use Mayo Clinic's measurement of the equilibrium dialysis, where we send the lab over to the US and they measure it directly. There's another way that we can do a free androgen index, and that is a calculated measurement, which means we measure the total testosterone and the SHBG levels, and through that, by proportion, we kind of like estimate what the free testosterone is likely to be. So just to note as well, I mean, I have lots of patients who come in to try to test the testosterone. We always test it in the morning because there is what we call a diurnal variation. It tends to be higher in the morning, so it's important for us to check it early in the morning. How common is testosterone deficiency? All right, so I mean, there's lots of talk about it on social media, so sometimes the prevalence of it may seem to be blown out of proportion. Yeah, so various studies have looked at the prevalence, all right, and because of the different inclusion criteria in the study, where some studies look at both the symptoms and the laboratory diagnosis, it seems like the prevalence seems to be about 2 to 6%, whereas if they just use the cutoff of 300, for example, the prevalence seems to be much higher at over 30%. So yeah, some people believe that as long as I'm really healthy, I'm really fit, I have lots of muscles, that I will not have low testosterone levels. I think that is not exactly very true, all right? Again, a very massive slide. I'm not going to go through every single thing, but I'm just showing the fact that, I mean, there are various causes for low testosterone. It doesn't mean that as long as you are very healthy and you have no medical problems and all that, you will not have low testosterone levels. So it's important that if you do experience some symptoms, it's important to check it. testosterone levels decline with age and our body mass index. So over here we can see the total testosterone levels, the free testosterone levels, and the bottom x-axis is actually the age. So as age progresses, right, you can see that the free testosterone level plummets quite significantly. And why is that so? We can see that the SHBG levels actually goes up as well with age. So when the total testosterone level drops slightly and the SHBG level goes up significantly, all right, the free testosterone tends to drop quite dramatically as we grow older.
Would TRT
Yeah.
help with free testosterone?
Yes, it will. Yeah. So again, some discussion about obesity and testosterone, because it's actually something that there's this what I call a bidirectional relationship, which means testosterone deficiency does cause someone to become obese more easily, right? Insulin resistance more easily, and all these risk factors also can cause low testosterone and metabolic syndrome, right? So these conditions are all there's an interplay between all these conditions, and sometimes it's a bit hard to differentiate which one comes first. Is it a low testosterone that has come first that has caused obesity, or is obesity the problem and that has caused low testosterone? So sometimes it is up to the physician and the patient to work through these things. So it's not so clear-cut sometimes whether we should initiate testosterone replacement therapy or really start to get the person just to lose weight first and see whether the testosterone improves. So again, a very busy slide. This is actually some studies that look at the different levels of weight loss and the effect on testosterone. So of course, some studies looked at surgery like bariatric surgery or what we call very low calorie diet. And we can see that losing a significant amount of weight, 30 to 40%, actually increases testosterone level by 200 to 300 nanograms per deciliter. Yeah. For a milder degree of weight loss, 6 to 14%, you can actually increase your testosterone level by 100 plus nanograms per deciliter. Yeah, so it's pretty significant because if let's say, the cutoff if diagnosis is 300 nanograms per deciliter and you're like 280, for example, I mean, if you lose some weight, I mean, you can easily go way above the minimum threshold, right, for diagnosis of a testosterone deficiency. So as I was saying earlier, by the 70s, right, about 70% of males seems to have a low testosterone level. But there is some debate on whether age itself is the real risk factor, or is it the obesity and the chronic diseases that come along with aging that is the real risk factor for low testosterone. So coming to some natural testosterone boosters, right? I think all of us are always very interested in what we can do to increase our testosterone levels naturally. Yeah. So this is my personal passion and advocacy about lifestyle medicine, and I use this to think about the different lifestyle changes that we can do to help to boost our testosterone levels and optimize our health in general as well. So starting off with sleep and testosterone. So a little bit complicated here, but basically there were studies done on sleep restriction, which means they put patients through a period of no sleep, all right, and they measured their levels of cortisol, which is the stress hormone, and their testosterone level, and to no surprise, obviously the stress hormone is higher and the testosterone level becomes lower. Yeah, and that obviously has some knock-on effects as well on their body, right? They tend to gain weight more easily. They tend to become insulin resistant more easily. So when we talk about sleep, we usually look at a few different aspects of sleep, right? Obviously, the first one is the duration of sleep. Well, the commonly thrown about term of 7 hours of sleep is pretty important, even though obviously not everybody needs that magic 7 hours. Some may survive with 6.5 or 6 hours. It really depends on how you feel, right, after you wake up from the sleep. If you feel that you're very well rested, sometimes for some people 6.5 might do the job. The other aspect is the regularity of sleep. So getting the regular hours, whether you sleep at 10 p.m. regularly or 11 p.m. regularly or 12 a.m. regularly, that also helps with our sleep cycle and our production of the hormones at the appropriate time. And thirdly, of course, the quality of sleep as well. Many patients who are obese also tend to have problems like sleep apnea, where they snore very significantly at night, and that can compromise the quality of sleep as well, to get very disrupted and poor sleep. Yeah, so these three things are what we look at in terms of trying to optimize sleep and therefore improving testosterone levels. And yeah, I was just talking to Eva just now, who is talking about sleep hygiene, right? I mean, for those who are not familiar with this term, I mean, I encourage you to really read about it. I mean, there are lots of videos and articles about sleep hygiene nowadays. Basically, it is certain things that we do on a daily basis as a habit to help us to get a good quality and good amount of sleep. Yeah, so things like getting exercise in the daytime, before you sleep, making sure that you are not looking at your phone. I mean, the light from the phone and the light from our surrounding actually tells our brain not to sleep. And also, like I said, getting a regular sleep routine so that your body knows when to produce the hormone sleep, like the melatonin, and when to wake us up from our sleep as well. Exercise and testosterone levels. I think Dr. Dinesh might be very proficient in this. Okay, yeah. So from my knowledge, all right. I mean, these are the few things that really boost testosterone levels based on certain studies that are done. So in terms of resistance training, all right, things like big muscle group activation. So when we use our glutes, right, leg muscles, those are really much larger muscles compared to our biceps or maybe like wrist curls. These are really tiny muscles. So bigger muscles tend to produce more testosterone secretion after the exercise. More muscle activation as well. So if you recruit more muscles doing like free weight exercises where you actually have to use more muscles to balance the weights, that seems to produce more testosterone as well. In terms of the intensity of training, if you do like cardio or HIIT, high intensity interval training, right, it seems like the exercise that is done at a higher intensity tends to produce more testosterone level as well. Okay, but a major caveat is that most of these studies that are done is actually they actually put participants through these exercise protocols, and they actually measure their testosterone levels right after the exercise. So it seems like there is a spike right after the exercise, but not all the exercises actually cause a prolonged effect on the testosterone levels, which is what we call the basal testosterone level. Yeah, so I think maybe for some of the gym trainers and all that, I think you'll be familiar with telling your clients and all that to use big muscle groups because of the large testosterone boost, and that can cause the hypertrophy to happen after the exercise. But the effect on basal testosterone level seems to be more significant in people who are older or overweight, right? Which makes us also think about going back to the fact that losing weights, right, bringing down the fats in the abdomen, the visceral fat, right, that may actually be the greater contributing factor for an increase in the testosterone level. So this something interesting as well. I mean, further bring home the point about the intensity of exercise. So this looks at the various protocols, right? Exercise protocols that the athletes will put through. So the athletes will put on this thing called the ergometer that they had to cycle at various intensities. So starting from 40% of their maximum to 70% and maximum intensity, and they measured their testosterone levels at various time points. So as mentioned earlier, it seems like the higher the intensity level, right? It seems like there's more testosterone that's produced at these intensities of exercise. There's this thing called overtraining syndrome, right? Which again, I think Dr. Dinesh should be an expert in, right? Overtraining syndrome really talks about how if we are exercising too much, all right, that the body is so fatigued, right? Some athletes start to feel that they are underperforming, right? They feel that they are not performing at their peak anymore, and this may mean that the body is just so tired from the excessive exercise, and this may be characterized by some athletes who do not rest, or they do not take enough, they do not get enough nutrition, right? They're not eating enough, and you can see quite interestingly when they compare the testosterone levels of athletes who are overtraining, healthy athletes, and sedentary people who are not exercising. All right, the overtraining athletes seems to have a testosterone level that is similar to a sedentary person, all right, compared to a healthy athlete. So I mean, this just illustrates the point that of course exercise is important, but if you're exercising to the point that we are not getting enough rest, like Peter was just saying, he had colleagues who used to go to Anytime Fitness at 2 a.m. to exercise and then go to work the next day at 7 a.m., right? I mean, you're probably not getting enough rest. So if you're at that kind of state, obviously that's not going to be able to be boosting your testosterone level. Eating soy will reduce my testosterone levels, all right? So this is something that's a lot of people on social media talk about as well. So I don't think there's any evidence for this, all right? So there's a recent meta-analysis, all right, done on thousands of men, all right? They collate data across many different trials, and it seems that there is no actual effects on soy on the production of testosterone. Yeah, so it is not true, all right, that if you are vegan or vegetarian, that you can't have high testosterone levels. I think we all know that there are bodybuilders and athletes who are also vegan and vegetarian as well. Another one that's always commonly talked about on social media as well, about the carnivore diet, is quite in vogue now, and you always say that carnivore diet is the best to have a high testosterone level. I can't find any evidence on this, that the testosterone is really, or rather carnivore diet is the best to boost our testosterone levels. So there are some various studies that are done to look at the effect of diet on testosterone levels. So the first one is pretty interesting. They actually surveyed different groups of people, and they grouped the participants into like the low-fat diets, the Mediterranean diet, and the unrestricted diet, which means you just eat anything you want. Okay, so there seems to be a very marginal difference. All right, the testosterone level for those who are eating a low-fat diet and a Mediterranean diet had a marginally lower level of testosterone compared to those who are on an unrestricted diet. Okay. Because the differences were so small, all right, the summary of the report said that it's very modest. So therefore, we shouldn't just say that because low-fat diet or Mediterranean diet causes a slight decrease in the testosterone level, therefore we should be avoiding all low-fat diets or Mediterranean diet, right? Because if you're aware, the Mediterranean diet is one of the most prescribed diets in most health guidelines, because that is the diet that actually prevents or helps us to reverse some of the chronic diseases and heart disease risk and all that. Yeah, so it is really a discussion to be had with the patient, all right, whether it is worth it to not do the Mediterranean diet or worth it to not be on the low-fat diet just so that he can get an increase of like 20 points of his testosterone level, right? Most probably people will think that it's not really that worth it. There's another study done on the high protein versus high carb diet. So the overweight men were put on an energy restricted diet. So energy restricted means that they are given a diet that is lower in calories compared to the amount of calories that they actually need. Yeah, and it seems that both the high protein and the high carbohydrate kind of diet actually increase testosterone levels to the same degree. All right, so it doesn't mean that if you eat more carbs or if you eat more protein that you will actually affect the testosterone level more. Okay, and another study was also done on the pro-inflammatory diet. So they were given out questionnaires to participants and asked them to give some idea of how inflammatory their diet is, right? So I think for those who are not too familiar with what inflammatory diet is usually things like processed food, fried food, all right, alcohol, probably things that your mom tells you not to eat, all right? So true enough, pro-inflammatory diet does increase the risk of a testosterone deficiency. So I like to bring this up generally because there's always a huge debate on what is healthy and what is not healthy, all right? And actually most guidelines do agree on certain things. For example, plants, fiber, fruits and vegetables, most guidelines will agree that this is actually something that is obviously healthy. What is not so healthy, I think processed food, added sugar and all that, usually there's quite a good consensus on that. There's always the in-between where there's constantly conflicting information because of nutritional studies that are always gaps in the evidence and gaps in the data. And that's why for most guidelines, we focus mainly on promoting what is clearly beneficial and avoiding what is clearly harmful, all right? Those in between, it's up to the individual, right, to look at the evidence and decide for themselves. Yeah, so, and in the Health Promotion Board in Singapore, I usually use this to simplify things for my patient. Again, we focus on getting enough fiber and getting enough lean protein, okay, and of course whole grains. And this can help most patients to navigate the very confusing world of nutrition, yeah, at least for the average guy. Supplements, I think we all look at supplements. If you get keen testosterone supplements, right, we get lots, hundreds and thousands of supplements that are sold on the market. And I think the evidence is not that strong, right, on a lot of these supplements. And even if there is any effect on the testosterone levels, it is usually very marginal. Okay, so things like micronutrient deficiencies for those who have clear deficiencies like vitamin D deficiency, vitamin B12 deficiency, obviously correcting those things may potentially help with the testosterone production. All right, there are some clinical trials as well that was done on these various kinds of supplements like Tongkat Ali, ashwagandha, and these are also very commonly found in many of the supplements. Some do have an effect, some do not have a great effect on individuals. So if you are ever keen to try some of these things, I would advise for you to perhaps test it and see. You can test the testosterone levels, see if that actually goes up with these supplements. But if it does not help you with your symptoms or the levels, then probably you're not going to be benefiting from these supplements.
Or let's say DHEA.
Yeah.
Is there, or any other really,
yeah.
Do you take them perpetually, or are you supposed to stop after a while?
I don't think there's benefit in taking them for a short while because what you want from the effect of added testosterone is the long-term effect. You see, so I don't think there's anything wrong with taking it for 2 to 3 months and stopping it, but probably whatever added benefit that you got while on a DHEA would probably go away right after 2 to 3 months. Yeah, so that's why I usually focus on trying to find out what the root cause, right, of the low testosterone level is. Because if you just depend on supplements, it doesn't actually help the client or the patient to reverse the actual problem. Yeah, it just makes them dependent on the supplement. Yeah. So stress and testosterone level, I found this pretty interesting study actually, right? So they actually did a study on officer cadets in the Swiss Armed Forces, and they tested their testosterone level as they went through the officer cadet school training. Yeah, so in the first 3 months, it looks like their testosterone level plummeted, right? It was a very stressful situation for them. It's a new training season for them, right? And therefore, it went down pretty significantly, okay? But towards the end of the training cycle, as they adapted to the stress, right, as they found more success and proficiency in what they did, it seems like their testosterone level went up. Yeah, so I think it's pretty interesting. I mean, it shows us that, actually our stress level does affect our testosterone production. But of course, if we are able to overcome our stress, if we are able to adapt, right, to what the challenges that we're experiencing, right, actually our testosterone level can go back up eventually. Yeah, so if we are in a space or a situation where we are under chronic stress, right, of course, we may not be able to bounce back up. Okay, so if anybody is experiencing a lot of stress and a low mood and all that, all right, you might need some professional help, right, to help to overcome the stress. Alcohol, smoking, all right, it does work on some parts of the brain, right, to reduce testosterone levels. Won't go into so much detail, but I think we all know that these things are not good for our health, for our heart, and also obviously for testosterone production. So just to bring home the point again about nutrition, physical activity, sleep, right, managing our stress, avoiding alcohol and smoking, I think all these things are relevant to actually optimizing our health and testosterone levels. So a little bit about TRT, testosterone replacement therapy. I get a lot of queries and calls about TRT almost every single week. Yeah, so testosterone replacement therapy is mainly to bring up the testosterone levels to a physiological level. So medically indicated kind of testosterone replacement therapy is not about what we call supra-physiological dosing, which means giving a level or replacing it to a level that is way beyond what a normal average guy is supposed to have. Okay, so of course we know that there are bodybuilders and people who use anabolic steroids and all that, but this is not testosterone replacement therapy. All right, we're talking about testosterone replacement therapy. You're talking about what is medically indicated and what is recommended by medical guidelines. So I just answered this question today. All right, if I'm feeling very tired, I think I need TRT. Okay, so this is extremely common. I think it's really blown up on social media. It's blown out of proportion, right? Not every case of fatigue and tiredness is due to low testosterone, and therefore not every case of fatigue requires TRT. Okay, so as a medical doctor, my job really is to look out for various causes of fatigue, right? And I always tell my patients that as long as you are in Singapore, you are working in Singapore, you're gonna get some fatigue, all right? This is a busy city. There's so many stressors all around you. There's taxes or whatever, right? The price of houses are going up, right? There's always going to be stresses. Everything is going to be causing you to be fatigued. So always look out for other causes, right? Look out for the blood test as well to confirm the diagnosis. And if we Google what the benefits of TRT is, like I've shown you, you're going to get like a multitude of benefits that are listed out, right? Like a laundry list of things. Okay, but actually, if you look into the details of all the studies that are done, all right, there are actually different strengths of evidence, right, that actually tells us whether TRT would be likely to improve certain symptoms. Okay, so for example, libido, unexplained low blood count anemia, or increasing muscle mass, there's pretty good evidence for that, compared to things like fatigue, all right? Even if the testosterone level is low and you're fatigued because of that, all right, there is not very good evidence whether increasing the testosterone level would really deal with the fatigue. So if the patient or the client or you yourself want to start TRT just because of fatigue, then you've got to be very sure that your fatigue is not due to other causes, because even after increasing the testosterone level, your fatigue may not actually improve. And you might find that because you have started, now you need to continue with TRT indefinitely. Okay, so that's probably not something that people want to do all the time. Since testosterone level is so good for me, should I start ASAP as soon as I can? Like the super soldier serum that Captain Marvel, or rather Captain America, took, right? So it is true, all right, that obviously you will get some kind of improvement in your physique and in your function, all right. But we have to be prepared for the consequences of TRT if we are really keen to start it. So the major thing about TRT is fertility, all right, because the testosterone is supposed to be produced by your own body, and your own body is supposed to produce the sperm as well. Yeah, so if you give testosterone exogenously, which means you are injecting it into your own body. It's not your own body's natural production of testosterone. It will actually reduce your body's own production of testosterone and sperm. Okay, so there are studies that are done as well on how long it takes for fertility to recover. Some studies show that it's 6 months to 12 months if you stop TRT. Some say that it's up to 2 years, and there's a small fraction of patients that do not actually recover their fertility at all. They remain what we call subfertile or infertile for the entire lifetime. Yeah, so I mean, I talked to some patients who are used to be bodybuilders and all of those things, and then they say that, you know, they heard about these things when they started the anabolic steroids and testosterone many years ago, but they all thought that it was a worthy trade-off, right, for their muscles. Okay, so there are ways to preserve fertility, such as using some other drugs, right, beta-HCG and whatsoever. We won't go into all those details, right, but even then, it is not a guarantee, right, that even when you use TRT together with these drugs, that your fertility will be absolutely preserved. Okay, so I think this is one of the major things that many people do not talk about on social media, right? Next thing is TRT and male pattern balding. Okay, so if you start on TRT, you might have the rocks body, but you might also have the rocks hairstyle, which is no hair, basically. Okay, so what this means is that, you know, if you already have increased genetic predisposition, all right, to developing male pattern baldness, if your parents, all right, your uncles and all of them have early balding, you might have an increased risk of that as well. And if you take TRT at an earlier age, right, you might just accelerate that process. Okay, so if you study at 30 years old or 20 years old, you might bring forward the age of when you get a male pattern balding by however long you just started the testosterone replacement. Next thing is what we call erythrocytosis, which is basically just a very complicated way of saying increased red blood cells production. So when the blood in the body is very thickened, right, because of too many cells, the blood can clot more easily, and that can increase the risk of things like heart disease and stroke. Okay, I would say that this is one of the more easily monitored kind of a complication, because you can easily do a blood test to see how thick your blood is. So I mean, for all practitioners who give TRT, testosterone replacement therapy, we do this very routinely. It's like a $10 plus blood test, just to make sure that the blood is not becoming too thick. There's some evidence as well that is coming up in the recent years. Okay, so if you actually look at testosterone guidelines from before 2020, I mean, some of them are still talking about like heart disease and prostate cancer. But in recent years, there have been increasing evidence, right, that has shown that there is no very strong correlation between testosterone replacement therapy and the risk of heart disease. However, there are smaller studies that do show that there's a possibility that in the first few years of initiation of TRT, there may be a small increased risk of heart disease. And therefore, those who have just had a heart attack or those who are at very high risk, they are smoking, diabetic and all that, we might really want to counsel them very strongly about the potential problems that they might encounter with TRT. The other thing is about prostate cancer as well. So there were some concerns about prostate cancer developing after starting testosterone, okay, because I mean, prostate cancer is what we call a very hormone-sensitive cancer, where we believe that the testosterone production can actually accelerate the development of the cancer. But the good news is that it does not seem to be any increased risk of prostate cancer with testosterone, okay, but there is some caution, right, in the guidelines that talks about metastatic prostate cancer, which means if someone already has prostate cancer and you're spread around the body, all right, there's some advice, right, to be more cautious about this group of patients and whether to start them on TRT or not. So a very busy slide, but this actually summarizes whatever I talked about. Okay, so usually we assess how severe the symptoms are for the patient first, right? Is it something significant, or is it just something that's very trivial? It's just feeling a little tired in the afternoon, right? That might not actually be something that's very severe to warrant starting TRT. We look at whether their symptoms will respond to TRT, which is what I was telling you about, whether, you know, if it's something like sexual libido, for example, that would definitely, or most definitely respond to TRT, whereas things like low mood and all that may or may not respond that well. And then, of course, we look at the problems that the patients might have or may encounter with TRT, and we decide and discuss with the patient whether he's something that the patient really wants to embark on. Okay, it's tiring to exercise. I just need to use TRT to gain muscle. So I just watched a video recently. It's quite interesting, the evolution of bodybuilders over the years. And back in the day, bodybuilders looked like this, but now they look like this. All right, so the key question is obviously, or the key ingredient is obviously some level of anabolic steroids. Okay, so while it's true that testosterone level, or rather testosterone boosting or replacement can build our muscle mass, but how about muscle strength and VO2 max? So I think I found this pretty interesting study, all right? Not a very big study, but I mean, it was something that they were trying to explore as well. So there were 80 participants, and they actually split them up into 4 different groups, all right? So one group had testosterone and exercise, testosterone, no exercise, exercise and a fake medication, a placebo, and no exercise and a fake medication. Okay, so the exercise was some form of strength training, some form of aerobic exercise, and it was a 3-month program, and they monitored their testosterone levels, obviously before and after the program. And sorry, not testosterone. They monitored their strength, their VO2 max, and the mass, muscle mass, right, before and after the program. So I think it's quite interesting. If you look at firstly VO2 max, right, which is our aerobic capacity, right. We can see that obviously those who exercised had a greater increase, right, of the VO2 max compared to those who did not exercise at all. So if we do just take testosterone level, take testosterone replacement, right, and we do not exercise, obviously there will not be any change in our VO2 max, our aerobic capacity at all. So unfortunately, TRT cannot replace exercise in that regard. Okay, for lean mass, it's quite interesting as well. Those who had exercise without testosterone, right, they had some increase in the lean mass. Those with no exercise with testosterone, they also had some lean mass increase as well. So, I mean, even without moving, it seems that the testosterone does have some effect. Okay, but the interesting part comes actually under here with the leg press, which actually measures the strength. So obviously those with exercise did increase their strength, all right, but those with only TRT did not increase their strength as much as those who exercised. Okay, so in summary, I mean, exercise alone obviously does have much more far-ranging benefits compared to only TRT. Okay, so if a man comes in and says that, you know, I'm not going to be putting in the hard work, I just want TRT to change my life, you know, I just want TRT to make me feel like I'm stronger, right? The good news is actually that without TRT, right, exercise alone can actually do much more than that. Yeah, so I would generally prescribe exercise over TRT, right, if there's no clear indication for TRT. So in summary, I mean, testosterone is beneficial for overall health and wellness, but it may also be a sign of poor health. So I mean, sometimes we don't just look at the marker alone and just start treating the number, right? We want to look at the overall health of the patient. We do not rely on symptoms alone, right? We actually look at the blood test to tell us in a more objective manner whether the symptoms may be due to low testosterone level or not. Optimizing testosterone level is usually part of a broader framework of optimizing our overall health, right? So we don't just focus on one number, but if we focus on overall health and improving our health, generally our testosterone level should also improve at the same time. And yeah, TRT is not the panacea to all problems, right? You know, not everything is treated with TRT. Okay, so yeah, I mean, just a brief explanation of where I'm from. I'm from ATA Medical, so we are a health screening and GP clinic where we have a variety of services available, and this is our clinic in Orchard. Yeah, so does anybody have any questions that I can help with? Yeah.
So
yeah.
You said the range for testosterone, let's say, is 300 to 900.
Yes.
If someone is on 600,
yeah,
do the adverse effects come up if you want to be on 800, or do you say, look, let's not do that?
Yeah, so I mean, within 800 is still within a physiological level,
Correct,
in a sense.
You're
Yeah.
not low. Like someone
Correct.
from average to upper limit, or within normal.
Yes.
What's the kind of trade-offs in that scenario?
So, I mean, there would definitely still be a risk of the side effects, such as, you know, male pattern balding, blood being thicker, I mean, erythrocytosis. So those things are still present, okay, but of course, probably not going to be as prevalent as if you are giving supra-physiological doses, right, of a TRT. Yeah, so...
and it can still impact one's own production, right? Even
yes.
if you had a good level. So if you come off it,
yes,
there's a chance that your natural basal level could be lower.
exactly, correct. So, I mean, you need time, or rather your body needs time to recover, see. So, I mean, if let's say it's kind of low, and you boost it up with a TRT, once you come off TRT, there will be a crash because your body now is not producing the TRT, right? And therefore, for whatever amount of time, 6 months or 1 year, you might be having very low testosterone levels, right? And that may make you feel like a miserable person, right? Until your body starts to recover the amount back again. Yeah, so that's why, I mean, patients generally need to be on it for the long run. Yeah, if they choose to start on it.
Yeah. If you're on TRT, sounds like it's a lifetime commitment to
Yeah.
some extent,
Yes.
not a cycling or a 1 year to boost your health commitment.
Yes, correct. So by guidelines and medical recommendations, right, that's the true indication for starting TRT, where we have really determined that someone really needs the TRT, and then therefore he actually should be on it for the long run. Yeah, if you can just reverse his condition with just 1 year of TRT, he may or may not actually really need the TRT in the first place, right? Maybe he just needs to lose some weight. Yeah, but again, I mean, it's a discussion with the patient whether he's willing to go through that whole cycle of TRT 1 year, crash, and have low symptoms of low testosterone, and then wait for his body to recover. Yeah, yeah, yeah.
Do you have any thoughts about some people talk about microdosing?
Ah.
You knew that was going to come up.
Yes. Okay, to be honest, I mean, I think in Singapore, we are very traditional in following the guidelines, right? I mean, in terms of like American guidelines or even British guidelines, I think they're all pretty standard in giving just what is written on the manufacturer's product inserts. Yeah, but I am aware that places like in America or even in Thailand, some places do believe in microdosing, which means, okay, maybe for those who are not aware of what microdosing is talking about, if we give testosterone replacement therapy, the most common forms of replacement are actually the injections. Yeah, so when the injection is delivered, all right, the testosterone level shoots up high, and then it will obviously dip gradually over the weeks. And then depending on what kind of injection is given, right, maybe after a few weeks or 3 months, right, the next dose is delivered again, and that's when you get this spike up, and then you get a dip, and get a spike up and a dip again. Yeah, so that's what people try to avoid when we talk about microdosing. Yeah, so when it's high, obviously you feel great, right? But as the weeks progresses and the testosterone level drops, then the patient, the client or the patient might actually feel like lousy and low again, right, until the next dose. So that whole up and down may make the patient feel like, is I mean, very, very conflicting. They feel good for a while, and then one moment they feel bad. Yeah. So for microdosing, what some people advocate is actually giving a lower dose of what is actually written on the product insert. So, like for example, the Nebido that we usually give, some people give like only a quarter or half the dose, and they give it more frequently. I think in the overseas as well, they sometimes just give the patients the testosterone to bring it home to inject themselves with it like every 1 week or so. Yeah, so I personally don't really do that, but I do see the benefit in actually doing that. Yeah, just I'm not sure whether it's something that is widely accepted in the Singapore community or medical community at this moment. Yeah.
Can it be done every day?
There are formulations that are done on an everyday basis. So, for example, there's a gel, what they call andro gel, which is a testosterone gel that can be applied every day. But that again sometimes can be or rather the absorption of the testosterone may be affected for some patients. If let's say they're hot, they're sweaty, and all that kind of stuff, the absorption may be quite variable. Yeah, so most people prefer to do an injection where it's not a daily basis kind of administration, right? But there are various ways. There are even like tablets for testosterone as well. But again, the absorption and all that, the effect is very variable, and from what I've heard, I mean, people need like many pills per day to be able to hit the required amount of testosterone. Yeah. Yeah.
Yeah. Soon after the dose, you get the suppression of the cortisol testosterone. Is it immediate, or is it like after a few days?
I mean, I don't have the exact data of the exact time frame, but I would imagine, I mean, it's pretty soon after, right? Because as long as your own body's production is suppressed within a few days and weeks.
One dose would shut it off for the 6 to 12 months?
I think the studies that are done are mainly on a certain duration of TRT. So they don't usually give one dose, right? They give like for example 2 years, for example, and then you see how long it recovers after 2 years of TRT. Yeah, so I am not aware of any particular data that says talks about like a once dose TRT and what the effect on fertility. Yeah. Yeah. Okay. Yep. So if not, that's it. Yep. Thank you for coming. Yeah. Yes. Yeah.
How long does an injection take?
How long does the injection take?
Yeah. I heard someone mention
Pretty
that
fast.
the TRT is like a slow 5-minute release that's super painful.
I usually don't take 5 minutes lah. Maybe 3 minutes or so. Yeah.
And it's quite painful?
It's not usually that painful though. Yeah. I mean, I'm not sure how that injection was done, but usually it's not that painful. Yeah. No, actually it's quite a big needle, but we give it in the butt, in the gluteal region. Yeah. So it's usually not that painful.
I
Yeah.
heard someone had like a, not, surgery is the wrong word, but basically they had something implanted in their butt.
Mm-hmm.
But it's like a slow release of testosterone over like a year or 2 years as opposed to an injection all the time. Is that a thing?
I'm not familiar with that. I don't think we have that formulation in Singapore.
It was a US.
Yeah. I'm not familiar with that because we only give the gel and the injection. That's quite commonly used, but not. I'm not aware about the implanted kind of formulation.